Housecall Providers is a nonprofit primary care practice. Housecall Providers fills that need of going into the home, providing care, providing stability, giving families that sense of security, knowing that their loved ones are cared for.
Housecall Providers cares for people with chronic medical diseases and difficulty managing just their daily activities.
We were going to a doctor. It was exhausting for Mom to go in to get her blood pressure checked or just general things. She was healthy. And finally somebody said, well, there is this place you might try. It's called Housecall Providers, and they come to you. It's not an all-day situation just to get basic things taken care of.
And so by our providers coming out to see them in the home to help them proactively manage their care, they do better and live healthier lives.
We moved my father in with us about 2.5 years ago. He was hospitalized a few times for pneumonia and a broken leg. And at that time at OHSU, when they were getting ready to discharge him, they recommended in-home care. And throughout the months, we got connected to Housecall Providers, and we haven't looked back since.
Up until I had the home care, I had to go out to a doctor's office for a 5-minute consultation on something, and that would take my energy and someone else's to help me. It has changed my life.
Having the nurses and the nurse practitioners and the doctors come into our home, see where we live, how we live, I think it gives them a greater perspective on who he is as a person and an individual, and it's just really nice. They feel like family.
It begins with a call into our office by a caregiver or by a patient, letting us know what's changing for them in terms of their health. That information gets communicated through our computer system to their nurse practitioner, physician assistant, or physician who takes care of them and knows them. And a visit is scheduled in which that provider goes out and does an assessment, understands and listens to what's been changing. We can collect additional things like x-ray or lab data if we need it, and then we make a change in their medications or their treatments to try to get them back on the road towards health. One of the critical pieces of the success of a house call is that we are able to take the time to listen to patients and understand what is most important in their daily life, what brings them joy. That's really the core of good palliative care, whether that's managing them in the hospital, whether that's managing them at home, or whether that's managing them in hospice.
Housecall Providers gives these patients what they need. We're there at the right time, in the right setting. My hope for the future is that there will be Housecall Providers throughout the nation to care for our parents and our grandparents and ourselves when that time comes. That's what I want the future of medicine to be.